Biologically, we should all be living to about 120. If we can get the average person to feel so healthy, so vigorous, so vital, that they want to work 1 year longer just in this country, that's worth about $1 trillion to our gross national product. Health is an investment in your workforce, in your people.
I'm joined by Dr. Mehmet Öz. Welcome, wonderful to have you here.
Great to be here.
What a career path from the hospital where you were a heart surgeon through TV and now in government.
Well, I like being in the change business. So if you can make a difference, then I get curious. Heart surgery, and which is my specialty, medicine in general, is such a wonderful career because you get to look at people in the eyes and you know you're there for them and they respect that and you can work together to solve problems. It's just hard to do that for millions or even billions of people. Television, as you know, because you do media, is a way for us to communicate ideas to get to many, but they have to be that's to be news you can use, information that's valuable that you can take into your day-to-day life. And oftentimes you get blocked because there are government policies that make it hard for you to do the right thing. So when the president asked me to serve as the director of Medicare Medicaid, which is the government's insurance for its people, I took the job. It's about a $2 trillion budget, the largest budget in government, but we have historically not wanted to fix it because it's so big and so scary and so complicated. But I think we have a generational opportunity to improve the way we deliver medicine, both in the United States, but around the world. And the reason for that, frankly, is AI. We have information flow that could actually allow us to predict problems before they occur, meet you where you are, connect with you on your phone even, and using agentic AI, give you tips and tools to avoid the chronic illnesses that drive 70% of the healthcare expense, but also give you longevity tips. Because biologically, we should all be living to about 120. If you stay tuned, we'll tell you how. But but very concretely, there are things we do, rookie errors, because we've never lived before. We make errors that if we'd lived once before, we wouldn't make twice. That folks, when they realize that it's too late to fix it, I think our government-supported insurance can change and lead the way in how we actually pay for things and pay for results, not pay for services. Don't just pay people to do more operations. Pay them to change people's lives for the better.
Based on your experience as a doctor, where do you see the biggest flaws right now in the medical system, of course, of here in the United States, but also worldwide?
Well, I've traveled the entire planet. My TV show was in 118 countries. So I would travel around and make programs. And so I got exposed to health systems. A good example is Saudi Arabia, where I've been many, many times. And in Saudi Arabia, because so many of the clinicians, the doctors were trained outside of Saudi Arabia, it's a very sophisticated health system. And they have tremendous amounts of data in a major building in Riyadh called Medical City. And it looks like you're at a spaceship. They have all these monitors everywhere following every little thing that happens. So that's the gold standard, I think. Just have the data in. But once you have the data, you have to act on it. So you have to build an infrastructure of primary care, which means if you don't feel well, who do you call? In most parts of the world, you can't call a doctor and get a quick answer. You have long lines. If you get through the lines, the doctors are overwhelmed. And I do believe we need to train more of those doctors. And the way you do that is by making it easier for them to get through their schooling and then give them help once they're in practice. So right now, for example, if I had a sore throat and I went to see a doctor, I'd have to wait in line and get the test. I could probably most of the time get my results without having to talk to the doctor if we built a system, if we paid for the services along the way so everyone can get faster service. And here's why that matters. If we can get the average person to feel so healthy, so vigorous, so vital, that they want to work 1 year longer just in this country, that's worth about $1 trillion to our gross national product. Multiply that across the planet and you realize that health is an investment in your workforce, in your people. And also it's morally the right thing to do. We have tools, we have innovation. We should be spreading the wisdom and allowing that to be used everywhere, but you then have to actually support the innovation. You have to protect it. And we now have a crisis a bit because we have other countries, China's a good example, that wants to rapidly move to take control of innovation, which again, they're a sovereign country. They should try to do as much as they can. All of us are trying to cure cancer, but we can't give up our innovative ability to cure cancer because we can't go as fast as other countries. That's why it pushes all governments to be thoughtful about how they regulate industry.
Lately, we hear a lot about preventive medicine and longevity for solving the issues you said and to make it easier to ease the burden on the system. But how do we make sure it is not just accessible to the ones who can afford it? How do we prioritize democratization of it?
The biggest challenge we have is that you have basic, simple ideas that everyone needs to do today that most people don't do. And then we have these more sophisticated, shishi, exotic, elite ideas that are experiments. And I say that because although I like those ideas and I use some of those ideas and we'll speak to some of them, they're not as proven as the basic ideas that all of us should be engaged in. The best example is obesity. The United States spends twice as much money on healthcare services, in part because the United States is twice as fat as other countries.
As simple
We're
as
10
that.
times heavier than Japan. So it's not just the obesity itself, is that it's hard to take care of people who are overweight. But if you are overweight, your chance of being hypertensive, high blood pressure goes way up. Your chance of having diabetes goes way up. And those work together to destroy your body. Why? The blood pressure is like a fire hose. It's blowing away, tearing the very thin Teflon-like lining of your arteries. And then the blood sugar is like pieces of glass shrapnel scraping the artery. Both of them together damage your arteries all the time, and you repair it with cholesterol, which is the body's plaster. So if you're eating the wrong foods, you have the wrong kinds of cholesterol, you have bad, cheap plaster put in there, you get blockage of your arteries. And those lead to strokes, to heart attacks, kidney failure, liver disease. These expensive problems that kill people when they're young, but if they don't, they just make you crippled, so it's more expensive for them to manage you. These are simple concepts. We have made it hard to be healthy in the United States, which is what the Make America Healthy Again movement is about. If then Secretary Kennedy is right. We have allowed food additives to be included. We've been dishonest about what foods are good for you. And I think these mistakes have really hurt our people. Now, transitioning to a more aggressive approach, I don't know, but do you eat breakfast usually?
Yes.
Okay, so I don't eat breakfast. Now, I don't eat breakfast for two reasons. One, I'm not hungry. Our ancestors, when they got up in the morning, generally wouldn't have breakfast ready for them. They'd have to go hunt their food. But in addition, if you don't eat breakfast, your hormones settle down because you're doing a little intermittent fasting. You had dinner at 7:38. Now it's 12 hours till the morning. Because you haven't eaten, your hormones begin to get relaxed. They don't actually push you to eat. And if you have your first meal, let's say at noon, which everyone watching right now could try this, intermittent fasting, it dramatically helps your hormones stay stable and therefore helps you lose weight. That's a simple tool that we use for diabetics. We also use it for people who have early dementia, heart disease, and a slew of other chronic illnesses. You could do that same technique across the board if people knew it. But of course, people don't know what they don't know. You have to take the public health system and make it cool, make it enjoyable, and give people agency to change their future. That's across the globe.
I heard you speak earlier about health diplomacy. Tell us about it.
Health diplomacy is a fundamentally important opportunity. When countries are not aligned, when they don't get along, when they don't like each other, and their leaders don't talk, there are bridges you can still build. And these bridges can be sports, but why not use health? We're all interested in our own bodies. We all want to make sure our families are healthy. I don't care if you like another country or not. We all have that goal. And so if we can take tools, advances, innovations, ideas, and allow people to exchange those concepts, you begin to build more and more bridges to make a quilt, a net, to pull people together. And I think very specifically about my own career, I invented the devices we use to fix heart valves from outside the body. That really wasn't my idea. I learned it at a conference in Italy from a foreign surgeon who was explaining it in a way that he thought had a different use, and it clicked in my mind. We both learned about a different way of doing this procedure because I was willing to listen to him and he was willing to explain to me. I think we have that example metaphorically across the board, and our administration is pushing hard for that. We're negotiating hard on some topics like most favored nation drug pricing, where we believe we're spending almost 1% of our GDP on medications, and other countries spending less than half that. So we want our prices. We spend 3 times more for these drugs than other countries, the same drugs. We should pay less and other countries should pay more because they should be investing in their health. And I think their country will benefit because people in these countries don't get the most cutting edge medications at the same time Americans get them. So this diplomacy has pluses and minuses, and it's not always going to be easy. Sometimes countries just disagree. The Chinese very much want to be the major innovators in medicine going forward. They see the opportunity of health diplomacy, of helping other countries, and therefore, they have a relationship. America and Western Europe have always had that role. We always brought the solutions to other parts of the planet. And so this is a competition, which I believe competition is good. It'll make our system more efficient, reduce the regulatory burden, and allow companies, private sector players, to get the finish line earlier, just like the Chinese are helping their companies succeed.
Dr. Oz, I heard you say that miracles happen when doctors with different experiences from different nations come together. That's actually the key of what we're talking about.
There's nothing more beautiful than having doctors who are passionate about patients sit down and just open up about what's working and what's not working. And more often than not, because we all face the same issues, other doctors are solving problems that we're stumped by, and maybe we have answers that they need. But together, we have a unique connection that supersedes the usual diplomatic channels. I liken it to what happened in the early 70s when Nixon, the president of the United States, needed to have a mechanism of talking to China. The first thing he did was send ping pong players over. Because ping pong is such a simple game that you can at least both agree that it's beautiful to watch. And that opened up pathways. We are hoping the same can happen with health diplomacy, and this administration is laser focused on these opportunities. Why the president speaks about these issues later today when he addresses this group, he'll be addressing medical diplomacy as well.
With TV, you brought medicine closer to the people around the world. What would you like your legacy to be with your current role?
When I'm done my job running the health insurance systems for the United States, I'm hoping that people look out there and realize that this agency could make laws with Congress, we could make rules, but the best tool we have of all, the most nimble tool, is the power to convene, to get people who normally don't talk to each other to actually start collaborating. And the best metaphor is in the Bible. It says the meek shall inherit the earth. The word meek, if you look at it, actually means a strong person with a sword that's sharp who could do damage. But they decide, because they're strong enough to sheathe their sword, put it away so they can talk, so they can work issues out for a while so that we can get past the crisis. That's where we are around the world. And we can address this crisis with the most powerful tool we have as humans, which is our ingenuity.
Thank you very much, Dr. Rose.